in Washington is not like international medical graduates friendly. So a lot of experienced doctor, they are not working. So this is like a wasted resources and potentials. So we came up with the idea to form an organization that will help these doctors to pursue their medical career here in Washington State. So, for example, as me, I had my bachelor degree in medicine and surgery, and I moved here to Seattle. I didn't know from where to start. What are the resources here available for the immigrants doctors? So I didn't know from where really to start. So the first thing come to my mind is to go for University of Washington and to ask from where what are the resources available for these doctors. So honestly, I didn't get that much help. And then I go back and look at the Facebook pages and asking if there's like any doctors who from abroad and they had their credential from outside here. And I started to look at the Facebook and I found just like one response. Some doctor, his name Dr. Mahmoud. He said that he is in Seattle, and he told me there is like another 10 doctors who are here in Seattle. So I was really happy that there's like some people in my situation, and maybe I can manage this and we can like collaborate and do a lot of stuff. So we started this mission, and we talked to the governor. We passed a bill last year, and this year we passed a law that helped international medical graduates to pursue and support them to pursue their career and support them get involved in the healthcare system. So yeah, and we made it same. And the same will apply for bridging care. Bridging care also, it's a new organization. Its idea is to help patients with chronic disease. So how we would help these, the idea to help these patients, with providing some services, which is called Health Home. So Health Home is not a place, it is a set of services eligible individuals, any patient with at least one chronic condition and at the process to get the second one. And this include all age group, children and adults. But the most important thing is that these individuals should have insurance, health insurance, Medicare or Medicare. Is that the current healthcare system often disjointed, and the process vary among between primary care cities and specialties site. And also the patient are often unclear about why they are being referred, and how to make appointments, and what they are going to do after they see the specialist. So the specialists do not constantly receive clear reason for the referral, and sometimes the adequate information and the tests are not really very clear why the referral. And the primary care physician do not often receive information about what happened in the referral visits. And also the referral staff deal with many different processes and lost information, which mean that the care is less efficient. And this will lead to multiple emergency room visits and hospital admissions. So the solution is easy. We came up with this idea to help these these patients. I'm really sorry, I keep saying doctors. So to help these individuals who need to navigate medical system and ensure their medical needs are addressed in comprehensive and cost-efficient manner. So we connect people with professional care coordinators who can who are certified and they are capable to help these individuals. And these group of specialists are physician assistant or a social worker or behavioral health professional. So what we do, That's what the core, sorry. This is the core service. So the core coordinator will work to reduce the gap in the services and increase coordination of all services provided, including medical, behavioral, and other social services. And this can be done by comprehensive care management, care coordination, like helping these individuals to connect with their care coordinate, primary care doctors, and schedule for their appointments and make referral, and also health promotion and comprehensive transitional care and individual and family support, and finally referral to community and social support services. This will include housing, of course. So this is the model for the patient self-centered. As you can see, there's a lot of factors that help the patient to get stable, and the care coordinators, or what we provide in our organization, will help the patient to take control of their health and become more productive. So our goal in Bridging Care is to establish person-centered health action plan to improve health-related outcome. And this can be done by seeing the primary care doctor on regular basis, as I said, and having preventative screening tests and taking medicine as prescribed. Also, this will lead in a reduction of unnecessary visits to the ER and hospitalization. Also increase the confidence and skill of for self-management of health, and this by taking control of treatment and learn about the medical condition and make changes that may prevent future decline in the health. So I can give you like an example. I have my aunt. She is she's been here in Washington for a long time. She's not speaking English fluently, and she's having a lot of chronic conditions. And kidney failure. So once I was sitting next by her and asked her, like, what is your plan with all these overwhelming chronic condition? And she said, the first thing that I want to do from today is to quit using the whole milk with my tea. So I was asking her, why you want to do that? She said, I want to give a trial to see how this will improve my health. Maybe I will get better after a week. So I will give a trial for 1 week, will help me or not. So I figured out that she's having a plan. She want to get better, and she want to feel healthy. And she's having also plans, but she needs just a guidance and a plan, someone to follow up with her every day. So of course, this organization and with all these services that we provide will definitely will help her a lot. So also the last thing of bridging care goals is bridge our existing care system. And thank you so much for listening. And you can visit our website, www.wamg.org. Thank you so much.
Thank you so much, Marwa, for sharing. And now we'll go straight into Lisa with Build a Bus Home.
Okay, here we go. Okay, so it all starts with community and begins with human-to-human connections. So imagine this 16-year-old kid looking for those human connections. She sought out a group to do some volunteer work and in working with homeless and housing and helping out with food and clothing sorting. And she started volunteering, and before long, it really felt like a calling to her to be of service, So she smiled at the possibilities because, at 16, that possibilities are endless, and even at any age. And Her entire life had been spent serving people in one way or another. So fast forward 43 years to the age of 59. She broke up with her girlfriend, and what we I just didn't know where I was going to live or what I was going to do, and or how to make it financially. Over the last 10, 20 years, we were facing homelessness a couple of times, and I knew from childhood what it was like. So I was just like, I wanted a small dwelling, a place to help people. And I was looking at tiny homes with converting a school bus. And all of a sudden I was like, what? We could do this for a whole bunch of people, for low income housing and people that don't have housing at all. So there's where the idea started. And well, one day while bumping along, God nudged the woman to help others like herself. And those nudges keep coming, I'm telling you. So anyways, about 6 months into the adventure, we have Build a Bus Home. I was going looking for a website name. And I thought, wow, they could be really costly. I looked at my checking and balance and it was $1.76. Wow, I'm not going to afford a website name now, but I'm going to look anyway. So there was one for 99 cents sale going on that day, and the total was $1.38. I was like, I could afford that. So there we go, Build a Bus Home. And we're introducing our cleanup bus and shower trailer. Here's some of our teammates. And our mission is helping humans to meet basic needs. So our volunteers here near the bus for the LDS missionaries. And about 6 months into my adventure, I ran into this wonderful human being, Aaron. And he had another part of the dream. I just didn't know it. He was bringing multiple communities together in construction and on and on. And so we started building things, thinking about hygiene. Along comes James, another piece of the dream. He's a truck driver. He can do things. He's got lots of skills. He's a good person around people. This is at a festival. And then there's Peter. He's a great teammate that's an organizer. And without him, we would not even be sitting here right now, I tell you. He's an amazing writer, a wonderful community organizer, and he has my heart, as everyone does. So, Peter, thank you. And then we have Larry, incredible writer as well. They work together well, and 30 years plus in social work. He's just a great guy. Look at that smile, huh? Why build a bus home? People are homeless. It's increasing all the time. Most people are like $100 away from losing their homes. And so we have two goals in mind. First, provide dignity to people currently living unsheltered by running the cleanup bus and shower trailer program that will give hot showers to those in need. And second, to acquire school buses to convert them into small, comfortable, permanent homes, which will be affordable and accessible to those who need them most. There's the day we bought our buses. It was a glorious day, very exciting. The process begins with taking the seats out, the construction, going under the bus and getting everything dirty on you. And no, it was wonderful. This is the whole group on the right, bottom right side. It's instructions, Aaron giving instructions to everybody on how to do this. So it's the rent affordability crisis. Poor people are living in the lack of affordable housing, loss of jobs, domestic violence, evictions, physical and or mental health problems, and addictions, just to name a few. And you know what? Nobody's story is any different. Everybody's story is so different. And as you can see, this is just a real serious crisis. So we decided along the way what we could do right now is take care of hygiene. So we came up with this. We got this trailer, and here we go. Access to basic hygiene, nearly impossible for homeless. And it's a really urgent issue, especially right now with COVID. We have a 53-foot, 17-stall shower trailer and hot showers. We could do about 40 people in an 8-hour period with the current COVID-19 safety precautions that we'll be taking into consideration. Here's our inside and the pull-out hygiene station with mirrors that pop up. It's just a beautiful setup. And here's what's connected to our gray water truck and then we just disconnect it and take it to lot. So COVID-19 and showers and safety. So we've got a real health crisis going on. We all know that. We recognize homelessness is very difficult to social distance. Their access to medical care is even more difficult right now. And we know that we can help with that. We take all the precautions the CDC has indicated. Soap and water will kill coronavirus, so a hot shower is a public health intervention. We'll be using Pure Green 24 to disinfect the showers after each use. And there'll be a misting tent of Briotech. And that is for health. And you can see why Briotech. It's made naturally on our white blood cells in our skin. And it's our internal defense system working to fight infection, reduce inflammation, control responses to injury, and enhance the healing process. One of the best parts about it is that it disinfects right then if you missed. So beautiful. Our most recent partners, so pleased, Molina Healthcare and Briotech, very exciting. So this is John, right after his shower in our trailer. And, you know, I had this dream of this self-sustaining community with buses, serving people through mobile hygiene and laundry, places where people can hang out and get to know one another, have community, build community. It's a home, a community, a village of care. It's my dream. We can do it. We have lots of opportunities for community to help. What would you like to give? Do you have some skills that you'd like to share with people? Are you interested in making a difference? Well, we want to talk to you if you identify with anything that you've heard or seen. So give us a call or go to our website, buildabushome.org/get involved. And you know we can do it. And I thank you so much for listening. We can do it.
Oh, Lisa, thank you very, very much for sharing that.
You're welcome.
And now we will move on to Kartik with Inclusive STEM.
Hi, everyone. My name is Kartik with Inclusive STEM, and just give me a minute as I share. So Inclusive STEM or ISTEM is basically our effort to try and empower 1/5 of the global population, which also, by the way, happens to be one of the most underrepresented populations in the world, which is people with disabilities. And we do this primarily using technology, community, and support services. But before I get too further along in talking about what ISTEM is, I just wanted to take you back to my own journey, my story. And it all started in the 11th grade when I had to choose an educational track for the rest of my high school. In India, where I grew up, there were 3 choices: sciences, commerce, or humanities. And I had very passionate about technology and science, and I knew exactly what I wanted to do, except that the Central Board of Education in the country at that time did not think that blind students were capable of pursuing science. And when that news came to me, and I was like, wait, what? What have I been really working towards then? Like, I have developed my passion in technology, and just because someone thinks that I am not capable of pursuing science. I won't be able to live my dream of becoming a computer scientist. Fortunately, I had supportive parents, teachers in school, and we advocated for all blind students, or rather all students with disabilities, to pursue absolutely everything that they wanted to in high school. And after about 40 letters to the chairman of the board and over 9 months and a demonstration for the chairman, we finally were successful to basically get the permission for all blind students across India to pursue sciences in the 11th and 12th grades. And I was so happy, and I thought to myself, oh, wow, the challenge is over and now I can do whatever I want and, study whatever I want. But again, 2 years later, when I wanted to go and join an engineering school, I hit yet another hurdle, because the top tech schools in the country at the time said, oh, we don't have the necessary support to help out a blind student who wants to pursue engineering, and we cannot provide you the reasonable accommodations that you need to take the entrance exam. And again, my life came to a standstill. I went to meet the director at one of these institutes, and his response to me was, hey, why don't you go into music or basket weaving? And I was shocked. This was a director at one of the premier tech schools in the country who was asking me to go and do something that I did not want to do, something like music or basket weaving, even though I had good academic record. Yet another person was like, Kartik, the fact that you're blind is your problem and not ours. And that was horrible, and it was a shocker. And I almost thought to myself that I wouldn't be able to pursue science anymore. And the most unfortunate thing, though, was when all of my mentors started advising me to think about alternative options. My teachers were like, oh, why don't you become a civil servant? Why don't you become a lawyer? These are much more accessible fields. Why do you want to get into science? And I was like, because I want to get into science, and that is what I enjoy. That's precisely why I want to get into science. It was as if, because of my disability, the world thought that I will have to make compromises, and that was just the standard thing to do. Fortunately, I had a few mentors who advised me to explore international opportunities. And I was very fortunate to be accepted to Stanford in 2013 here in the United States, where I completed my course in computer science. But what I found at Stanford was actually even more shocking. I realized that one of the biggest arguments that the Indian authorities had was that you cannot compare India and the US, we don't have the resources and we won't be able to provide you the support. But when I came to Stanford, I realized I did not use a single resource or a single piece of technology that wasn't available to me back home. So that excuse really did not make any sense at all. And this, coupled with my passion for technology, inspired me to do something about the situation. What was worse was this problem was not unique to me. There are billions of people with disabilities around the world who do not get equal academic and employment opportunities. We have affirmative action. We have seats exclusively reserved for people with disabilities in India. But what after that? Who is going to provide them the support once they join institutes? And that is the problem. Who is going to try and bridge this gap between employers and people with disabilities, where employers think, oh, they just can't do anything or they're slow? And so that's what we're trying to do at iSTEM, really trying to basically use technology to empower educational institutes and businesses, and in doing so, of course, empowering people with disabilities themselves to try and do absolutely everything and anything they want to do. And so the way this works is basically we provide them two things using technology. The first thing is a framework where we help them to develop frameworks through which they can support their students and employees with disabilities. And this includes a cloud-powered or tech-powered interface where they can go and onboard their students or professionals with disabilities, understand what the global best practices are, but not only understand these things, but also really make all of this actionable by onboarding their own organizations to follow these guidelines, by creating processes in place through which their students and professionals can request these services, through which they can track these requests, through which they can track the various assistive technology that their students or professionals might be needing for their day-to-day activities. And the second part is where we use artificial intelligence to try and automate a lot of the most commonly used services that students or professionals with disabilities use on an everyday basis. So whether that is, converting a printed document into something that a blind or visually impaired person can access independently in a variety of languages, including Indian regional languages, or whether it is to provide custom real-time captions for someone who is deaf or hard of hearing, where they can have access to every video just like anyone else. And this includes, by the way, taking into account the specific terminology of the video. If the video is a biological video or a biology lecture, then the speech recognition system should be able to account for the specific terminology in the video. And so that's another service that we provide and we try to automate to make sure that everyone has access to whatever information that they need. And finally, provide volunteer connect. I cannot emphasize enough the power of community. And we want people to come together, the disability community, but also allies to come together and co-create solutions to problems that the community faces. And so we act as a facilitator in this process using technology to try and bring people together to try and make this difference. And this is just a sense to give you of the number of people that I'm talking about here. Again, as I said in the beginning, it's 1/5 of the global population. 200 million youth with disabilities who need access to equal academic and employment opportunities if we want them to contribute to our economy. So, really a large number of people that we're talking about here that we really want to try and empower. So this is our current progress right now. So we're working with 7 academic partners in India, 4 corporates right now. We have reached out to about over 1,000 students with disabilities now through our various outreach programs and community, and by providing these services. We also have an active, vibrant community of 200 people with and without disabilities that work in a variety of initiatives with us. And of course, we are working with a lot of corporate partners that get sensitized in the process and really understand the value of working with people with disabilities, of hiring them. One of the biggest things, and the statistic I love, which is when your products are accessible, you basically are tapping into $8 trillion worth of economy. And so it's a large number, even from a business perspective, which is what we do with our corporates. We tell them we don't want charity. Now is the time when you really should be starting to think about students and professionals with disability. You need to invest in them, just like any other employee of yours. And so we've been fairly successful. A lot of people have been hired, and we continue to sensitize them through other initiatives of ours, like hackathons, where people with and without disabilities, they work together on projects and not only learn skills, but also develop empathy in the process. Really understand, what it's like to be a person with a disability in coding. It's not rocket science. People get used to it, and it's okay for different people to use different skills and different technologies and different experiences to ultimately, reach the same goal. So that's kind of like the sensitization that we're trying to bring about. So these are some of our partners. So we've been working with Stanford in the US, a bunch of institutes in India, tech schools, and as well as a few of the corporate partners. And this is our team. So ISTEM primarily consists of people with disabilities. So we have firsthand experience, as I shared my story, about what it feels like to have and not have access to the same opportunities. What does it feel to have and not have access to these services that empower people with disabilities to be successful just like anyone else? And so I think that's kind of where our passion comes in from. We're determined to make sure that no other Kartik in India has to go through all of the challenges that I did. And everyone has whatever they need. And this is basically just to give you a sense of what our plans are, really trying to scale up really quickly, have been, again, as I said, fairly successful. And this is where you come in. We cannot do this by ourselves. World cannot become accessible. Every single day when you contribute something to the web, do you think about whether this is accessible to over 1.3 billion people with disabilities? We post something to Facebook every day. We post something to Twitter, LinkedIn every day. And most of us, we never bother to add alt text or descriptions to our pictures. Why? We've got to do that. And there are a lot of other opportunities available where we can really use your help and your support. And I invite you to join us on our journey by visiting inclusivestem.org. Thank you so much for being here today with us. I really appreciate it. Thank you.
Kartik, thank you so much. That was great. And now, last but not least, we will move on to Mikkel with Angels for Angels.
Hi, everyone. My name is Mikel Samaniego. I'm the founder of Angels for Angels. First of all, I just feel so privileged to be on the same webinar with everyone here. All of you guys are amazing. You inspire me. So I want to just share a bit about Angels for Angels and why we do this. We really believe that like our core mission is that we help you change the world. And yeah, I mean you. Every single person that we talk to, we believe that you can change the world. And if we treat you like that and listen to you as such and work with you to do that, then it's possible. And I'm gonna give you guys some examples. I was talking with Steve. What's going on, Steve? Our grant writer. And it was very much so that like, Steve, you are writing grants for organizations that are changing the world. And by you doing that, getting them the funding, they can change the world. And I was talking with Wendy. What's going on, Wendy? Our new executive coach. And it was very much, Wendy, you are coaching nonprofit leaders like Kartik, like Lisa, people changing the world, and you helping individuals overcome their obstacles have ripple effects far beyond that we can imagine. And everyone, not just our internal team, our donors, but also the nonprofit leaders. Like Lisa, I'm looking at you right now. How cool. I've just seen you grow so much as a leader. And as you grow as a leader, Build a Bus Home can just do so much more. And this is just so great. There's a connectedness. And that's really the heart of Angels for Angels. And our vision long-term is having a global community of connected change makers and just people committed to social change, because together we can make a lot happen. And then really what I believe, and I think all of us really believe this, and we can have that experience, that through helping others achieve their greatness, you and I can achieve our greatness. And that really guides us. So now I want to share a couple of stories. First, my personal story, how this happened, and then the story of Jane, one of our first projects that we worked with. So when I was a little guy, all I ever wanted to do was play professional soccer. And I sacrificed a whole bunch, got a ton of rejection, and had a lot of people sacrifice a lot for me too. And through that, I was actually able to achieve my goal of playing professional soccer, but I knew that it was super selfish and that a lot of people sacrificed for me. So I promised myself that I wanted to do something more, something that would have an impact beyond myself. And so sure enough, I didn't have any skill set, and I decided I'd go back to school. So I went and studied international development and nonprofit management at UCSD, and did my summer internship in Kenya. And it was there that I met Jane. And Jane inspired me. She, at the time, was working for Save the Children, and she was traveling all around Uganda. And she noticed that there were countless deaths that she knew could be prevented because she'd seen other people do something about it. But in Uganda, suicide was very taboo and no one wanted to talk about it. But she just by herself started having conversations, and little by little, she would go into schools and more people would listen and know that they had another way. And when I met her, she was doing this, and her dream was to start a suicide prevention hotline. And I was like, I was surprised that it didn't even exist. And she didn't have the funding for it. And I didn't know how much that would be. Turned out it was $1,700 to start a suicide prevention hotline in a country. So we went home through a fundraiser and raised enough money for Jane to start this. And that was our first project. And then seeing Jane, she took that, she got onto national news. She organized these national protests and marches. And then she got her own office inside the national hospital, Mukono Hospital in Uganda. And that experience was very much like, wow, if we work with people that are changing the world, we can be along with it and we can make a difference alongside them. So I guess that's really the why of Angels for Angels, to change the world. We want to change the world. And how we do that is we listen, and then based on that listening, we create. Our best ideas are not ours. Our best ideas are the results of our nonprofit leaders. The fact that this virtual charity gala very much is a direct result of that. There were a lot of in-person fundraising events that got canceled. People were down. What can we do? And you know what? We said, we can do something. And together, this is a direct manifestation of that. And so specifically, some of the other things that we do is, well, I guess our core competency is fiscal sponsorship. We help new organizations get started, and sometimes they'll stay with us and we'll do the administrative back end. And sometimes it's just kind of in the gap from when they apply to become a nonprofit until they actually become a nonprofit, so that from day one, they can start operating as such. We've started an accounting firm, A4A Accounting, and that gives us sustainability. And we also leverage that to do the accounting for our nonprofits. We just started a mastermind group with Peter Smith. Peter, what's going on? And this has been incredible. A lot of our presenters here today are part of that, and it's building a peer community that didn't exist. A lot of us, when we start nonprofits, we have all the heartfelt reasons why we know what we want to do, but we don't know how to do it. So being able to plug people into a community that's all pulling for you is really powerful. And then the next thing that we're just launching is the executive coaching with Wendy. And I've personally benefited from having an executive coach, because there's too many times where I get in my head, and if left to myself, I think that, you know, I'm not good enough, or that I can't do it. And it really takes me having a conversation with someone to let me know, you know what, I can do that, and I will do that, and I do that. So that is a bit about Angels for Angels. Don't want to make it about us, but I want to actually turn it over to everyone here. Piggybacking on the thing that I think really sets us apart is really listening and then thinking what we can do. My invitation for every viewer here is to think about what you can do. And if it's a donation, awesome. That would make a huge difference for all of us. And if it's not, that's okay too. Maybe you can get groceries for your neighbors. Maybe it's just having a phone call with someone. Maybe it's calling someone out of the blue and saying, I love you. That is why we're all here. And so my invitation to you is, with everything going on, think about what you can do and pay it forward. And for those of you who have the ability to donate, the donation page, the link is on right now. It's angelsforangels.net/virtual-charity-gala. This is actually a screenshot from the page. And if you guys donate, then all the projects here, all the organizations will split the donations, and it'll have a profound difference. And if not, and if you just wanted to feel good by hanging out, thank you. That's why we do this. So we're going to put everyone's contact information on the screen now. So all of us, and I can speak on behalf of everybody, we would love to hear from you if you'd like to talk to us. We do this for people. You are people. We do this for our community. You are our community. One of my favorite bars in Rio de Janeiro, Brazil, it has a saying. It said, "There's no such thing as strangers, just friends we haven't met yet." So I encourage all of us to think about that. So Macy, if you want to stop the screen share. Oh, and I will, for everyone, I will post in the chat bar the donation page for everyone to donate. Give me one moment. And then we're all going to say an official goodbye. So hold on. Thank you, Peter. Okay. So now Macy, if you want us, let me put us in gallery view. So everyone, on behalf of everyone, guys, unmute yourselves and say thank you.
Thank you so much.
Thank you so much. Thank you,
guys.
Okay, thank you.
Thank you so much. Thanks for joining.
Thank you.
Thank you.
Thank you
So much.
All right. End meeting.